Hello, I'm Dr. Robert McGeed, Associate Professor of Surgery at the University of Colorado School of Medicine. Welcome to the Surgical Risk Preoperative Assessment System known as SURPAS. This video will offer suggestions on how to discuss SURPAS results with patients. After entering your patient's information in the SURPAS tool and determining the individual predicted postoperative adverse outcomes, you can print the patient handout and use it to guide the risk and consent discussion with your patient. The patient handout shows the patient name, procedure, and today's date. A grid of stick figures visually demonstrates the patient's risk on the left versus the national average risk on the right for each of the 12 potential complications. In SURPAS, the 30-day risks are individualized and include the following: death, one or more of the following complications, unplanned readmission to a hospital, infectious complications, need for a blood transfusion, pulmonary complications, urinary tract infection, venous thromboembolism requiring treatment, cardiac complications, renal failure, stroke, and discharge not home. Discussing these results prepares patients, families, and providers for the postoperative course and to take steps to decrease these risks. Most importantly, patients find SURPAS helpful in guiding their care discussion with their provider and families. They like the handout because it's easily interpretable and they can take it home to review and share with their families. This allows patients to focus on the conversation rather than trying to recall all the details from a clinic visit.
So as a patient and you're visiting your doctor, sometimes it's hard to recall everything that he said to you. So it's really important to be able to take home something to your family members and your caregivers to let them know what was discussed within the visit. And it's nice to have that handy tool to do so, to recall all the information that was shared.
The conversation should be tailored to each patient's clinical scenario, and special attention given when you judge a risk of a particular complication is high. For example, determining that a patient is at a high risk of requiring a blood transfusion may lead you to order a type and screen and ensure cross-matched blood is available for the operation and during postoperative care. Patients at high risk of an infectious complication should be educated on signs and symptoms to monitor them and the steps to take should one develop. The handout can guide the discussion of advanced directives, goals of care, and DNR/DNI status. Using SURPAS in the clinical setting can immediately benefit patients, clinicians, and healthcare systems. Accurate, individualized risk is quickly determined and easily interpreted by patients and providers to facilitate an informed and shared medical decision. Identifying high-risk patients may improve resource allocation and facilitate targeted interventions. Ultimately, we believe this will improve perioperative care and lead to better postoperative outcomes. Thank you.